Hello, everyone. Good evening. Hello, healthy moms. Hope you all are doing well. And hope you're just doing fine. How is the evening going for you? It's a bright, beautiful Friday. And I thank God for life. I thank God you're here. I can see one person watching already. Please, if you're around, please leave a comment so that I can acknowledge your presence before we go on. You can see two people around already. Please, if you're around, leave a comment, please. Let me try to share the link. If you're here, please share the video so that your friends, other women can join. Please share to save a mother or an unborn child because pre-eclampsia is really a serious matter and it can lead to a lot of life-threatening effects on the mother and on the baby. So please share so that we can go on with this. Thank you so much for joining again. If you're around, as I said, please do leave a comment so I can acknowledge your presence before I go on with the live. I'm trying to invite some other people. I'm doing the sharing as well, so please do share as well. Okay? Thank you. So, how was your day? How are you doing today? How has life been treating you? Just let me know. Let's have a little chat before the others are joining, and I'll be getting into the real business in about a minute time, so I don't waste your time. And we talk about what we're supposed to talk about, and we can get out of here as fast as possible and learn what we have to learn. I am talking about this topic today, not to scare mothers, but to help mothers and empower them with this knowledge because it is very, very important that we know these things, right? Because knowledge is power. When you know about something, you are more equipped to handle it if it happens to you. Though, God forbid, it won't happen to you, but in case you see it happening to somebody else, you can help the person. That is the main reason why we talk about all these topics, such that you are not surprised to a certain situation. And if you see another mother in that particular situation, you can help. So I'm going to be going on with our topic for the day pretty soon. But as I said, we are sharing right now, right? We use the first few minutes to share so that other people can join us before we go ahead. So while I was doing some research on this topic, I posted a video to kind of make mothers aware, to create some awareness about our live session of today. And a mother shared her beautiful story, her scary but beautiful story. I'm always very happy when I hear mothers share their experiences about certain situations or certain conditions that they face with their motherhood journey. And I am so pleased and delighted when they do that because I believe that if African mothers share their stories more, then we won't be in the kind of situation which we are in. Maternal mortality rate is very high, infant mortality rate is very high, part of which is because mothers are not educated, and even the ones who are don't share their stories. Like there are things that our mothers told us, but they didn't give us any reasons to those things. There are things that happened to us as pregnant women when we were pregnant, but the hospital didn't explain very well to us. So there are things that we go through, but we don't even know what it is. So I would like us to please, if you're a mother, you've had a certain experience and I'm talking about it, you can share your story through my WhatsApp or Messenger. I'm Larissa Livella on all social media platforms, or you can send it even to our Inyango inbox. If I have to put your story out, I would like to let you know that I'm a very private person, so I respect privacy a lot. If I have to put your voice note out, I'll work on your voice so nobody can recognize the voice and know it's you. If I have to put your message out, I'll crop your name out. Or if it is a message which is in the way that if I put it out there and I show my screen, it's going to show the person. I'm going to try as much as possible to tell the story myself without letting people know that you are the one who told the story, except in the case which you are delighted to share your story, which I can even invite you on one of our lives so you can share your story and give you the opportunity to maybe advertise your business, talk about what you do, create an audience for you as well. This is mothers helping mothers or women helping mothers. That is what we do. So I can see about 5 people here. Thank you so much, Lady Inda Sonita, for joining. If you are around, please just leave a comment, leave a like. Don't forget to share the video because these topics are very, very important. A lot of mothers go through it, but they don't even know what they went through. So please share the live so that other people can join us, other mothers can join us. It will help save a life and it will help save an unborn baby. So let's go right into the topic of the day. Today, I have my book as always. Yeah, I hope you have your book to jot one thing or the other. Because these things, if you don't jot or if you don't practice teaching other people, I learn by teaching. If you don't practice teaching other people, you are going to forget it. So just so that you have the information in hand, you should try to maybe jot. Or after this, teach your mother, look for a young mother and tell her about it. Tell your friends about it. Anyone who wants to hear, just tell them. If they like, they should say, you be show. It's okay. If you're showing with something that can save a life, then you're doing a very good show. Okay? So thank you so much, Tita B, ex-buyer, for joining us. Thank you so much. She says, I love the topic. Thank you. I can see Osam Water. Thank you so much for joining. I can't read the first name. I'm going to pronounce it wrongly. That's why I didn't go there. I can see Lady Van. Hi. Thank you so much for joining. Wow, she says, I had a classmate who died a couple of weeks ago from pre-eclampsia. You see, this topic is one which we should really talk about because most times they'll present with no symptoms. So when we talk about it and you know how it can present, you know the importance of you going to the hospital always, then it's just a win-win. We don't lose mothers, we don't lose children. Yeah, our world is better. So let me go right into the topic of the day. Welcome everyone who is here. Thank you so much for joining. So today we are talking about pre-eclampsia and eclampsia. I would like us to know that this is just one of many hypertensive disorders that usually happen to women during pregnancy. Now, these things are very common because during pregnancy, your body is going through a lot of things. Oh, okay, that's Lady Happiness. Thank you so much. The name is so strange. I know he has Lady Happiness, so the other name, I'm like, who is this person? Thank you so much for joining, Lady Happiness. It's just one of the disorders. And during the period of pregnancy, a lot of things are changing in your body. Like your body is going through a lot of processes that a lot of things can go wrong without any real causes. So there is nothing that maybe you can do to prevent or yeah, because I know what the question somebody's going to ask me is, what can we do to prevent it? Because we are all afraid of dying, right? If you hear that somebody died from pre-eclampsia, you're like, what can I do to prevent it so I don't die? But we have to understand that it is not just about dying. Before it gets to the stage where somebody is dying, then it has been in a situation that maybe it has progressed to a certain level before it got there. So what is pre-eclampsia actually? If you saw the short video I put up, then you should already know the meaning. Pre-eclampsia is high blood pressure during pregnancy, accompanied by signs of damage in some of the organs of the mother, organs like the brain, because it affects the brain somehow, the kidneys and other things which might cause swelling and all. So when it's accompanied by damage in some organs in the mother and shows some level of distress in the fetus, that is the baby who is in your tummy, that is pre-eclampsia. If you just have normal high blood pressure during pregnancy, it can be managed. But when it gets to these stages where there is there are signs of some damages in the mother's organs and some fatal distress, then it has gotten to the stage of pre-eclampsia. Now, when does it get to the stage of full eclampsia? Because it starts at a level of maybe just high blood pressure, your blood pressure being a little bit high during pregnancy, and then it can progress to the level of pre-eclampsia and then progress to the level of eclampsia. Now, what's eclampsia? Eclampsia is a state at which the blood pressure has increased and has led to the level that it has started affecting your brain functions and also leads to seizures and comas. That is a very, very severe state. And I don't pray that any mother should get there. That is the state where if you get there, it can lead to death. But there are things you can do to prevent it from getting to that very high level, right? So today I'm going to be talking about everything you need to know so that in case this starts with somebody who is around you, you can be the first doctor. Because before we go to the hospital, most times when you go to the hospital, the doctors will have to maybe take your weight, take your BP, maybe put the thermometer on you to check your temperature. All those things take time. In the time which they are doing all those things, or you might go there and you have to sit and wait for a long line because maybe you came late. In the time which all those things are happening, there might be a serious issue progressing. But if you knew about the condition and you know how serious it is, someone like me, if I get into the hospital with a situation like that, I'm going to be running everywhere and shouting at everybody who I can shout to for help, because you know how serious that situation is. But in a case where you do not know, you might see the pregnant lady showing some of these symptoms where you don't understand what they are. So you get to the hospital and they tell you, just sit a little while we get to the doctor, and you sit and you're waiting, not knowing that your friend, your sister, your mother, or that loved one is dying in your own arms. And then maybe later, after some time, when you realize what was actually going through, you start feeling guilty to yourself and you're like, maybe there was something I could do. This is the time we get the information that we can get, we empower ourselves so that we don't die carelessly. A lot of cases of people who die in Africa is partially because of carelessness. When you don't know what is going on, it is very possible that you can die anyhow. If you do not know that even something as pure and as wonderful as water, if you don't know how to take water and you take it in an excess way, it can lead to death. So this is the reason why we have to always seek for information. Share our stories, because by sharing your story, you might be helping a mother who is in that situation and doesn't know. So now let's go on to the topic. Let's go on with the topic. So preeclampsia usually happens around 20 weeks of gestation, like 20 weeks of your pregnancy. That is usually at the end of second trimester. And all along through third trimester, the pregnant woman is in high risk of preeclampsia and eclampsia. So from 20 weeks above is a risky time, because the causes of preeclampsia have not yet been discovered. It makes it even difficult, and you just need to know about it to help yourself if it happens to you. Because it is, from some research done, it shows that about 5% of pregnant women, or 1 out of 7 women, has preeclampsia during pregnancy. Excuse me. Now, as I said before, preeclampsia and eclampsia are just particular types. For example, pre-eclampsia itself is just one type of the many hypertensive disorders that can happen to a pregnant woman during pregnancy. Some other ones include gestational hypertension, which is the beginning of the pre-eclampsia. You also have superimposed pre-eclampsia. Like, there are so many types. Pre-eclampsia is just one out of a big umbrella of many hypertensive disorders that might go on in a pregnant woman. Now, as I said before, a lot of things are going on in the pregnant woman's body, things which are new to her body, things which her body has never gone through. So these things might just happen even if you don't do anything. But these are some causes which are being explored at the moment, because the main cause, like one thing which causes pre-eclampsia has not been found, like one main thing. For example, we can say mosquitoes cause malaria. For pre-eclampsia, there's no one main thing that causes it. Thank you, Lady Agnes Ojong. Thank you so much for your contribution. Great. That is true. Carelessness is bad. Yes, that's very true. Carelessness is very bad. Thank you for joining, Lady Agi. Now, let's go on to the causes of pre-eclampsia. If you have any questions, please be sure to drop them. I'm thinking of starting a new series. I'm going to let you ladies know about it, but I need your questions to make it possible. Okay, so let's go to the causes of pre-eclampsia. Now, the main causes, as I said, have not been found, but these are some potential causes which are being explored at the moment. The first one is genetic factors. Genetic factors might lead to pre-eclampsia. Another one is blood vessel problems, and also autoimmune disorders. Don't worry about these things, are not things that we can control. Just leave the big names to the researchers, to the medical people, let them do their research. So those are the three things which they are claiming that might be possible causes of preeclampsia. But up till now, the main cause has not been found. Please, I would like to just drop this right here. If you're watching me from Inyango, I can obviously see your comments. But if you're watching me from my personal Facebook account, because I'm broadcasting the live on my Facebook account and on YouTube as well, then I am not seeing your comments. So please, if you comment and I don't reply to your comments, don't feel bad. I'm not ignoring you. It's just because I'm not seeing your comments because I'm on a particular page and all the comments most times don't pop up right here. So I'm obviously going to see your comments later and I'll make sure to love them and leave a reply if I have to. So if you have your questions, just keep leaving them there. I'm going to see you later if you're watching from my personal Facebook account or from YouTube. If you're watching from YouTube, do not forget to subscribe because it's very, very important to us and it's going to help save the life of a mother or a child and help us raise healthy, wealthy, and exemplary mothers. So now we just talked about the causes. Oh, thank you, Lady Jackie is here. You're so welcome. I can see Lady Vera. Thank you so much. And our able midwife, Lady Lina Aisha, is here. I'm waiting to get all your contributions, Lady Lina Aisha. And for those watching, if you've ever heard anything about preeclampsia, make sure to drop it in the comment section. It's not just me talking here. If you know anyone who has gone through preeclampsia and you learned anything from it, drop it in the comment section and we'll all be learning. Now, I just talked about the causes. Let me go on to talk about some risk factors or things that if you have them, puts you in a higher chance of getting preeclampsia and eclampsia during pregnancy. Now, some risk factors include multiple pregnancy. Yeah, I get a lot of people tell me when I say I'm a mother of twins, a lot of young ladies tell me, oh, I want to give birth to twins too. Yeah, I pray that you all give birth to twins, but you have to know that to whom much is given, much is required. As you can see, the first thing on the list is mothers with multiple pregnancy. Twin mothers are more likely to have preeclampsia during pregnancy, though I did not have preeclampsia. Yeah. I did not have pre-eclampsia during pregnancy, but during my first weeks of pregnancy, I remember Lady Aisha and Mark Hobby, who were my midwives on my first day, told me my BP was high, and they were like talking to me, what's wrong? What's making you to be thinking so much that your BP is high? And I just stopped working. So it was disturbing me. I was a very active person before, and it was disturbing me, and it made my blood pressure to go a little bit high. So I would like you to know that any little thing during pregnancy can lead to your blood pressure being high. So you just have to try to be calm. Get some people who you can talk to, get someone who you can explain your worries to so that it doesn't get to the level where your BP is very high during pregnancy. Now, I was talking about some risk factors, and the first one was mothers with multiple pregnancy. The second one was age over 35 years. Mothers these days or ladies these days are concentrating so much on career that makes them to sometimes want to give birth after their 30s, after 35. I would just like you to know that it's not a bad thing to concentrate on your career, right? But just know that there are a lot of risk factors for mothers who are getting pregnant after 35. Pre-eclampsia is one of them. Now, early teen pregnancies, like pregnancies between the early 13s, 16s, 17s, might also have a high risk of preeclampsia. Now, another factor is first-time pregnancy. So in your first pregnancy, you are more likely to have preeclampsia during pregnancy. But not all first pregnancies do have preeclampsia during pregnancy. Like my case, I was already looking at where I was. I'm already at the first risk factor is mothers of multiple pregnancy. I was a mother of multiple pregnancy, and it was my first pregnancy. So I was already at very high risk of preeclampsia, but I didn't end up having preeclampsia. So you can still be in these risk factors and you don't have it, but it is important that you are aware. Okay, the next thing is obesity. If you have a BMI which is higher than 30, I had sent BMI to the group. If you've not seen that, check our post and you'll see the ranges of BMI. And if you wish to know your BMI, you can send your weight to our inbox or send it to me privately on my messenger, and I'll try to help you calculate your BMI so you know where you are and you can stay safe of pre-eclampsia. The next thing is history of high blood pressure. Mothers who've had high blood pressure before stand a very high risk of pre-eclampsia. Now, also, mothers who have history of diabetes have a high risk of pre-eclampsia. Also, mothers who have history of kidney disorders also have a high risk of pre-eclampsia. So those are the risk factors if you have multiple pregnancy, you're over the age of 35, early teen pregnancies, first-time pregnancy, obesity, history of high blood pressure, history of diabetes, history of kidney disorders. All these things put you at high risk of pre-eclampsia. I can see Lady Jackie said I was watching from your Facebook account. I've been watching from your personal Facebook account. Oh, saw you there. Just switched to. I see people switching from my normal Facebook account to here, but it's okay. It's just important that we get it open. Open it. It's open. Excuse me. It's just important for us to get the information, no matter where you are. But I know you want to be seen, even if I was the one who want to be seen. So that's it for risk factors. Now we are going to go on to some of the symptoms. Now, I would like us to understand that, excuse me, talking is not easy. My God, my throat really gets dry. So I would like us to understand that nothing can really prevent this pre-eclampsia and eclampsia or high blood pressure during pregnancy. But some doctors usually prescribe baby aspirin to some patients. It doesn't mean that if you're pregnant, you should go and take aspirin because I said it. No. I did not say so that you should go and take it. I just told you what doctors usually do. So if you are pregnant, you can have more knowledge and you might be able to ask your doctor if you can take aspirin as a prevention motive for pre-eclampsia. Not that you should go and buy aspirin and start taking it without being prescribed. Pregnancy is very delicate and you don't just take drugs anyhow. I will try to give you as much information here so that you are more confident and you can ask your doctor more questions when you go to see them. So now, in as much as doctors cannot do anything or there is no real prevention for pre-eclampsia, early detection of pre-eclampsia or early diagnosis is always the best, which is why you have to try as much as you can to attend all your antenatal classes. Because in those visits, it is possible for them to check your urine in your blood, urine in your pee. It's possible for them to check your BP. It's possible for them to see any complications that are starting to show at an early stage so they can easily handle it, right? So it is very important for you to always go for your antenatal visits. So, since it is very important to manage pre-eclampsia at a very early stage, how would you know how to manage it if you don't know the symptoms? So let's move right into the symptoms right now. I told you I have my book right. Excuse me, there's going to be a little bit of noise. Okay, let's move on. Now, some symptoms include persistent headache, abnormal swelling in the hands or face. Now, these symptoms are complicated because there are some people who just normally have migraines, and during the last trimester of pregnancy, sometimes when you just get dehydrated or you're hungry, you might get some headache. But as you heard in the first symptom, persistent, if some kind of headache that you don't understand where it's coming from and it's not going away, then that is it, and you need to start going to see your doctor. Also, abnormal swelling in the hands or face. This is very normal during pregnancy because during pregnancy, our faces swell, like not that much, but your face just gets kind of fat. Your nose just gets fat somehow. And at times, you might also get swelling in your hands and in your legs. But if it is abnormal, like it just abruptly happens, like you just want to look at your body, you're swelling, then please rush to the hospital. Now, sudden weight gain, which could also be swelling, which looks like weight gain, right? Because if your body is swelling, you might see it as if you have gotten a little bit fat, right? But that is usually a symptom of preeclampsia. Now, blurred vision or a dark spot in your vision, like you're seeing some kind of round dark spot in your vision, then that is also a symptom. Now, pain in the upper right abdomen, like immediately under your ribs, where your ribs end, right? If you're feeling some pain in there on the right side, I'm touching the left side. My machine is on mirror, so it's really confusing me. If you're feeling some pain immediately where your ribs end, right? If you're feeling some really sharp and persistent pain there, that is also another symptom. A high blood pressure of 140 on 90. So if you go to the hospital, most times they'll do your high blood pressure and they'll write it in your hospital book. When they write it, look at the amount. If it is 140/900, it's usually mm or hg. That's what they write. Or higher, then please try to calm down. Calm down yourself. In pregnancy, there's a child growing inside of you. It is very delicate. You don't take care of just yourself anymore. You're taking care of yourself and that growing child inside of you. So please don't let stress get to you. Okay? Do not let stress get to you. Is there any pregnant woman in the comment section? Please notify us so that we can all be checking on you and making you to laugh from time to time and sending you fun videos so you can watch them and your blood pressure can come down. Okay, so please try as much as possible not to stress. Try as much as possible for your blood pressure not to get to the level of 140 on 90 or higher. Now, another thing which you won't see, but when you go for your routine antenatal visits, they would see is protein in your urine. If you have signs of preeclampsia, protein in your urine is one thing that usually shows. And also, they will test your blood for every antenatal visit you go. They'll always take your blood. I really hated that part because it was like every time I go, they'll puke my hand. And I'm like, what's this? It always hurts. So those things are for these checkups because if you have preeclampsia, it will show some abnormal liver enzymes, which will show through your blood or your urine and other things. So now, since we've talked about the symptoms, I'm just going to try to list them out again because it is very important for us to know the symptoms. Persistent headache, abnormal swelling in the hand or face, abnormal and abrupt swelling in the hand or face, sudden weight gain, which could be as a result of swelling, blurred or dark spot in your vision, pain in the upper right abdomen, a blood pressure of 140 on 90 or higher, protein in the urine, abnormal liver enzymes, and low platelet levels. So those are some of the main symptoms, right? But I'm going to go ahead to talk about some other symptoms as we go on, so stick with me. Now, treatment and management is very dependent on the level of your preeclampsia. It's dependent on whether the preeclampsia is mild or severe. If it's severe, they might have to take some really drastic measures immediately because it can lead to very life-threatening conditions in the mother and the baby. In some cases of preeclampsia, when it gets to eclampsia, the doctor is bent to choose between the life of the mother and the child, whom to save. So you can get to that level. And in some cases, like what Lady Van Hein was telling us here, that she lost a friend some weeks ago to preeclampsia, the friend and the baby. In some cases, the mother and the baby might die. Okay, so those are some things which we should consider for us to I'm trying to organize some things. Oh, what's that? I'm trying to put the topic and I just put a wrong one. Anyways, let's just go on. Now, we are going to be talking about some of the possible treatments to preeclampsia during or after pregnancy. Did I mention preeclampsia can also happen to a mother after birth? If I did not mention, it is possible to also happen to a mother after birth, like few months or weeks after birth. A mother just shared her story with me, as I was saying in the beginning of this live session. She had a a case of it after which she gave birth, immediately after she gave birth. And that was a story that she shared. I'm going to try to share the story here, but maybe that is after my live or next week. So now let's go on to possible treatment options of preeclampsia. Now, most times, as I said before, preeclampsia presents itself around 20 weeks of pregnancy, at 20 weeks or after 20 weeks. Now, if you are at 37 weeks or later in your pregnancy before presenting preeclampsia, the doctor is going to induce labor. I'm sorry about that. If you are at 37 weeks or later, the doctor is going to induce labor. And if your case of preeclampsia is before 37 weeks, the doctor is going to try to monitor you closely to see when it is safe for you and the baby for the baby to be delivered. So immediately preeclampsia shows itself in your pregnancy, it is an emergency. The doctor will either admit you or you're going to be under some form of treatment. Usually they'll give high blood pressure treatments to help with the blood pressure. And they might also give medications to prevent seizure. You might be admitted so that the doctors can really follow you up very well. Steroid injections might be given to help the baby's lungs develop quicker. Because immediately you present preeclampsia, the baby can't stay in there for long. Now, preeclampsia happens because normally it's the placenta which gives food and everything that the baby needs to the baby. So if the blood vessels which connect the placenta to the baby and to you are not well formed, that is what usually brings up the case of preeclampsia. Okay, I'm just trying to explain it in a way that it's a little bit simple and we can understand it more. The reason why these blood vessels might not form fully is not yet fully known. So it's a very, very complicated thing, which we can only try as much as we can to diagnose this as fast as possible so it doesn't progress to the level of eclampsia. Because once you've gotten pre-eclampsia, it could progress really fast if it is not managed very well. So now I've talked about many methods of treatment. Like, for example, I talked about medication to lower blood pressure. I talked about medication to prevent seizures. You might also be admitted. Steroid injections might be given so as to help the baby's lungs develop quicker than it is supposed to, so that in case the baby needs to be delivered before time, the baby will still stay alive. Now, it is important to note that some symptoms might not even show themselves. Symptoms like distress in the fetal heart rate, changes in the fetal heart rate, rather. I'm going to switch right here to my phone because I was jotting in my phone before I started jotting in my book, and then time caught me, so I couldn't jot everything that I jotted in my book on my phone. So I'm just going to go on to my phone right now to be able to get some of my jottings and finish up with this. So there are some symptoms which you as a mother will not notice. Things like the baby's heartbeat dropping. That is what they mean when they say fetal distress. When a child is in distress, some of the things which happen is it is because their heart rate has dropped. So their hearts are not beating normally. They are not getting enough oxygen as they are supposed to get. Maybe the blood flow to them is not as it is supposed to be. That is all fetal distress. Fetal is your baby. I don't know why I'm saying fetal. Distress in your baby, so that we can understand this very well. So that is typically what it is. Now, things like changes in the fetal heart rate, in the heart rate of your baby, which indicates distress in your baby. Might not, you as a mother, you might not know it. So your baby might have, the heart rate might drop onto the level where the baby's not breathing anymore, until the baby might even die inside of you, and you might not know, because the only thing that we know is that when our babies are moving, we know our babies are okay. Now, but it's not all the time that the baby is moving. So your baby might not move for 30 minutes, you don't know that it's a problem, because the stress will make the baby not to perform as normal. Now, abdominal pain, like I talked of, the pain that happens just around your ribs or directly under your ribs, is another pain which you might feel that maybe I've walked a lot, maybe I slept on the wrong side, that's why I'm feeling that pain. And seizures, that's one thing which you're going to see, or maybe people around you are going to see, but they might not know that those seizures are due to pre-eclampsia or eclampsia, because immediately the seizures start happening, that is eclampsia. And the only thing they can do to solve that particular case is to take that baby out of you and the placenta as fast as possible. And in our African society, where we don't have doctors, or let me not say we don't have doctors, I'm sorry about that, where we don't have our medical facilities are not that fast, it's very dangerous. Please don't wait to the extent in which things have to get to that kind of emergency, because you might not get a doctor on seat, or you might not even, like, it might turn bad. It might just turn bad. So pre-eclampsia might also show symptoms of impaired kidney or liver functions. These are things that you might not notice. As a pregnant woman, you are bound to go to the restroom very often, where you might realize that you're not peeing as much. That is also a sign which you might not notice, because at times you pee too very often, at times you don't pee very often. So those are things that you might not notice. Also, fluids in the lungs are also things that you might not notice. Pre-eclampsia affects a lot of organs in the body of the pregnant woman. That is why it is considered as an emergency, and it is supposed to be taken into consideration or managed immediately so that it does not progress, because it can progress really, really fast. Now, treatment after delivery may include, excuse me, now, as I said before, the pre-eclampsia can also happen after delivery. Now, when it happens after delivery, there are some few things that the doctors will do. They'll normally check your blood pressure and try to give you drugs to regulate your blood pressure, take your pressure down, and try to just calm you down generally in such a way that you will become normal. But after pregnancy, it is not so complicated. Now, as I said before, preeclampsia occurs because maybe the blood vessels which connect the placenta to the baby and provides food and everything through the placenta are not well formed. Now, somebody might ask me that, excuse me, why then does preeclampsia occur after the mother has given birth? That's the question which even doctors cannot answer. Like, I tried to do so much research about it, asked even doctors about it, and they couldn't give me an answer. They were like, they wish they could tell me straight what causes it after delivery, but they don't have an answer since the main cause of preeclampsia has not been discovered. Now, there are some other complications which might present themselves with preeclampsia, which might be very, very serious if left untreated. Now, some of them include bleeding problems due to low platelet levels. Platelets, it's actually pronounced platelets, sorry. Bleeding due to low platelet levels. This is one of the cases which your mother was telling me about today. As I said before, that when she gave birth, after she gave birth, she was bleeding, and then she realized her blood pressure was very high, and they didn't even take her to the ward with her baby. They had to leave her in the labor room and take care of her first. She didn't understand what happened because it wasn't explained to her. Can you imagine? So those are some things that might come up. Bleeding. Also, placenta abruption. I've talked about placenta abruption, I think, in our last live session, which is a case where the placenta leaves the mother's leaves the attachment, because the placenta is attached to the womb somehow. This is a case where the placenta leaves there before time, because the placenta is only supposed to leave the uterus, which is the womb, when the baby is about to be born, so that it can come out to the baby. But it doesn't even come out before the baby comes out. So when the baby comes out, it takes some time for the placenta to discharge, to detach itself. Sorry, not really like a very long time, but the placenta is not supposed to come to detach itself before the baby. Because most times, if it detaches itself, it means the baby is not getting any blood flow from the mother, the baby is not getting any nutrients from the mother, which makes it very, very complicated. The baby gets oxygen, everything, nutrients from the placenta. So imagine that the placenta detaches from where it is holding, where the blood fluids which connect those things. It's like you unplug a switch. Like maybe you're trying to on maybe your one of your appliances, and then you unplug your fridge and you expect to on it. It's not going to work, right? Because electricity passes through the plug to get to that appliance. That's like the simple case between a mother and a child. So if the placenta comes out before the baby is born, that can lead to severe problems. Now, another complication of preeclampsia, which might happen to the mother, is damaged liver, like liver problems, damaged liver. It can also lead to kidney failure. It can also lead to pulmonary edema. I don't really know what exactly this is, but I tried to do some research on it. It is so much to be read about, and I cannot even take a minute or two to explain it. So those are some of the complications that come with preeclampsia. And also, some other complications which might occur is might lead to the baby being born prematurely, that is before time, or it might lead to pregnancy loss or infant mortality or maternal mortality. So it is very important that we know these things. I think I've elapsed all what I jotted on preeclampsia, but as I said before, if you have any questions, don't hesitate to send them to me. Okay? Please do send your questions, no matter what they are. I cannot answer a lot of questions here because I'm trying to make my live sessions shorter so lots of mothers can join and they can pick the information which you're supposed to pick and just go away. But if you have questions, do not hesitate to send them on our inbox, on our Inyango inbox. If you're scrolling through your screen, you see an inbox when you get to the page. You can send your questions there, and also you can send to my Facebook page, to my Facebook account, my messenger. I'm Larissa Livella on all social media platforms. Anywhere you want to get me, it's Larissa Livella. You can drop your questions there. I see a lot of mothers sending their questions lately, and I'm very appreciative of that because it's going to help more mothers to learn. Thank you so much for being here. I don't know if you have any questions, but if you do, I'll be waiting for your questions and I'll be so happy to answer them. My light is already failing me. I didn't bring my video light out here because I didn't want to stay here so long. But preeclampsia is a topic which you cannot really talk about it without giving details like the way I've done now. If there are any details which I left out, I would try to send maybe a flyer, maybe a short video, just some things you should know about preeclampsia. But know that preeclampsia is one condition which is very common. Is very, very common, and it can happen to anyone. It has some risk factors, but it can happen to anyone, even someone who is not within those risk factors. So that's everything I brought to you today about preeclampsia and eclampsia during pregnancy. As I said before, preeclampsia is just one of the hypertensive disorders during pregnancy. And if you're willing to hear more about them, just leave a comment, leave a question. Like, if you leave more questions, we'll talk about more things. Because now at times we just think of topics which mothers need to know and we talk about them. It's just about me and maybe the team who is working behind to produce all this content, who are thinking about those topics. If now mothers can help us, tell us exactly what they want to learn about, ask us questions about things which they are going through, then we'll be able to present more information which you want to know about. So that was it for today. I want to thank everybody who joined us. I'll just go through, call their names, and say thank you to you. I still see some people. Please leave a comment if you can. Like the live session, share it if you can, because by sharing, you help the information to go further, and you can help a mother without even knowing. Imagine if you share it to your Facebook friends, like you share it to your Facebook account, and then one of your friends, one of the 1,000 friends you have on Facebook is having this particular situation and it helps them. Or imagine that you share it and then one person from your Facebook account shares it as well. It just keeps going and it keeps helping mothers and saving lives of children, innocent children out there. It is very, very important for us to share. I can see Lady Jackie Nanga. She says, "Thank you, Madam EA, Madam Ayoketa." It's AE actually. Thank you. I can see Lady Vera. Thank you so much for joining. I can see Lady Lina Aisha, as our able midwife, working with the Nyango team all the time. I learned a lot from her. I can see Lady Agnes Ojong. I can see Lady Happiness, who presented today with a very hard name, Osam Water. That's the name she came with. I thought I had her other Facebook address, but I just see a different name, and she had to tell me to her. Thank you so much for joining, Lady Happiness. Thank you so much, Lady Van Hein, for joining. Thank you so much, Lady B Tita. Thank you so much for joining. And Lady Inda Sonita, thank you so much for joining. We are going to be ending our session here for now. If we have any more information, we're obviously going to put it onto our page. Please try to review our page. There's an option to review the page where you can give us 5-star or 2-star or 1-star. Just give us a star. It helps a lot. If you're learning so much from here, we really appreciate that you give us a 5-star so that Facebook can recommend us to other mothers, because it is with your reviews, recommendation, your shares, your comments, your likes, the little things you do that won't cost you any money can really help us go far and can really help us impact more mothers and help more mothers prevent maternal mortality, prevent infant mortality, help us raise healthy, wealthy, and exemplary mothers, and help us build healthy moms with healthy homes. Thank you all so much for joining, and may God bless you all. Thank you so much again. I can't appreciate enough. Hope to see you next week, Friday. Don't forget to share, please. Hope to see you next week, Friday. Do have a beautiful evening. And if you have any questions, don't forget to drop them. We will check them out and we'll send you answers. To have a beautiful evening. God bless you.